Good morning, everyone. Thank you for joining us. Please note that this session will be recorded and will be made publicly available on our YouTube channel. I am positive I know everyone here today, but I'm still going to introduce myself. My name is Bailey Sterling, NNLM Region 3 Technology and LIS Coordinator, and I'm co-hosting with Katie Pierce Farrier. Katie, did you want to introduce yourself?
Yes, I'm Katie, and I had the pleasure of working with Amy this past semester as we explored telehealth libraries. So it's been wonderful working with her. So thank you.
Thank you.
Katie is our data science strategist and has been integral to our internship programs this semester. Today, we will be seeing the NNLM Region 3 2022 Spring Internship Final Presentation of Amy Peck from Texas Women's University. Amy will be showcasing the work she has done with our office over the last semester. In addition to our intern, the wonderful and supportive NNLM Region 3 staff and Lewis Library staff, we have with us today Dan Burgard, University Librarian and Vice Provost for Scholarly Information Management. Dan's also the Director and PI of NNLM Region 3. We have Brian Leaf, Executive Director of NNLM Region 3, and Dr. Carol Perryman, Associate Professor for the School of Library and Information Studies at Texas Women's University. Dr. Perryman, would you like to say anything before we get started?
Well, just again to offer my thanks and appreciation for you working with Amy as a virtual, in a virtual exercise. We've had to change a lot in order to adapt to the pandemic. And this is yet another way, but so meaningful because I know that she'll take her knowledge and her passion to her own area of the country to become involved. So you guys help get that going, and I really appreciate helping her become exposed to how the sausage is made, basically.
I think that's a great comparison.
Yeah.
For those of you who don't know, Amy does go to Texas Women's University, but lives in the Pacific Northwest. That's correct, Amy?
Right.
So it's really early over there right now. So thank you for being here with us today.
Sure.
This month, we are hearing from our 2022 spring interns, Iram Fatima and Amy Peck. Today, Amy is presenting, and Iram's presentation was last week. So thank you for everyone who joined us for that. And like I mentioned, those presentations will be available on YouTube if you missed them or missed Iram's. Iram and Amy have been working diligently all semester to complete their robust projects. Their substantial efforts have opened doors for future NNLM Region 3 outreach efforts and have allowed us to assess new avenues we can take to connect with the varied populations in our region. In addition to their professional and academic responsibilities, they have consistently met with Region 3 staff to carry out their internship duties. Their presentations this month fulfill their final obligations to our internship program. Today, Amy will share with us what she's been working on for the past few months in partnership with our data science strategist, Katie Pierce Farrier. Amy's work has been built around NNLM's efforts to understand the telehealth landscape in libraries in the United States. Just as a little bit of a refresher, NNLM is the field force of the National Library of Medicine. We are focused on health literacy, progress in the field of medicine, and improving public health. We're divided into 7 regions, and we are Region 3 here in the green. Both Texas Women's University is located in Region 3. And so that's why Amy is an intern with us, despite living in the Pacific Northwest. And then here is Amy here on the right, and then Iram, who you may remember from her presentation last week. This presentation will be immediately followed by a Q&A session. Please feel free during the presentation to type your questions into the chat, or you can wait until the end and unmute yourself if you have any questions for Amy or for us. And with that, I will hand things over to Amy.
Well, thank you. I appreciate everyone coming here and supporting me and listening, especially post-conference. So let's get started. So the pandemic has changed the world as we know it. The way we work, the way we interact with others, even the way we access our healthcare. And for many of us, it's also provided the opportunity to rethink what we really want to do. For me, that meant returning to being a librarian and courses at the Texas Women's University in a postgraduate certificate for evidence-based health sciences librarianship. In one of my classes, I came across an article about Diane Connery and the Pottsboro Library. And later, when I had a chance to interview Diane, something really resonated with me. I've been working in a healthcare clinic now for almost 5 years, and I think the need for telehealth in public libraries has never been greater. So today this is going to be very brief. I'd like to share my practicum experience with the Region 3 Telehealth Interest Group, as well as provide a brief overview of the environmental factors influencing telehealth in libraries through a pest or environmental scan analysis. Here you see the main charge for our group. So the Telehealth Interest Group will serve to assess needs, challenges, and opportunities for NNLM and its members regarding telehealth in their communities. And this was the charge for the group. And I just want to introduce really quickly, we use the term telehealth rather than telemedicine for the name and the purpose of our group. And I know Pam de Guzman, the researcher and nursing professor at the University of Virginia, she uses the word telemedicine in her research, but for the purposes of the project today, we'll use telehealth. And let's look at some of the things that we encountered. Some of the considerations is how to apply for IRB approval, and if each region would have to individually submit an application. This is to work with human sources, human subjects, if we were to interview them for our work. We also decided to become an interest group rather than a working group, and we submitted our charter accordingly about that. And then back in March, we reached something of an impasse over the discussion of how to proceed with the IRB. We temporarily took a brief breather, and when we reconvened 2 weeks ago, I think it was with renewed interest, with a plan to introduce an educational program in telehealth resources to the library community. So what's a pest analysis? This is the project that I've been working on. The pest analysis is a strategic tool usually used to identify external environmental factors that for a new venture or a business, what's affecting that entity. And so we'll look at the political, economic, and social technological factors. And I'll briefly explore how these factors affect telehealth programs in public libraries. And here we see the pest analysis. And this, for many of you, you probably recognize as the Pottsboro area public libraries telehealth room. First, we'll look at political. And again, I'm just going to be very brief with these. There's so much information. We'll just try to condense it here. So some of the status of the recent legislation that affects telehealth as a whole. So I'll start with the Telehealth Extension and Evaluation Act. This was introduced at the beginning of February of this year. It's legislation that would include a 2-year extension of the telehealth waivers set during the pandemic. It would ease restrictions on where and what type of telehealth services could be offered and allow providers to prescribe medications remotely. And this legislation is still pending. The other I want to mention today, you see here, the Protecting Access to Post-COVID-19 Telehealth Act 2021 would make many of the pandemic rule changes permanent, including the expansion of telehealth for Medicare in the event of future PHEs or public health emergencies. And this would include allowing homes to be considered an originating site. So for people who are using their computer at home and receiving care through a telehealth visit. And this bill is also still pending. One bill that did pass just in March was the Senate Omnibus Bill. I think of this almost as a stopgap measure that would extend many of the pandemic-driven Medicare telehealth policies for 151 days after the end of the PHE, public health emergency. So, and then on the state level, many of the states, I believe about 37 states, implemented their own telehealth rules. And I've included a link after the slides to the site that reviews these. So these bills reflect an all too rare partisan support. It's hard not to wonder what will happen if the pending legislation isn't passed, or how the fall's midterm elections might affect the total political picture. And moving on to economic. As many as you know, there have been a number of responses to the pandemic in terms of funding, and we'll just again briefly review a few here. Here's the CARES Act, and then also the American Rescue Plan Act, ARPA, that was enacted last year. And public libraries throughout the United States utilize funding from both of these sources for a variety of needs, including digital services that can be used for telehealth. For example, Missouri used its CARES Act funding in 2020 to enhance broadband access and devices to 39 library systems across the state. Among the recipients was the St. Louis County Library's GrandPad program. It provided 1,500 of these telehealth-ready tablets called GrandPads for people 75 years and older. The library is expanding this program with the aid of an additional $2 million in ARPA funding. And then two government agencies that I just want to single out here are the Federal Communication Commission and the Department of Agriculture, which also give funding. The FCC's Emergency Connectivity Fund offers grants to libraries to buy hotspots and laptops, while the E-rate program provides discounted broadband to schools and libraries. And the USDA's rural program provides grants and loans. I think this is interesting for not just devices, but also for construction as well in libraries. So while funding from government programs has had a significant positive effect on many libraries, many others still face the prospect of budget cuts. It's important to know that smaller libraries may not have the resources or the staff to fill out applications for E-rate. And while technology spending has increased greatly during the pandemic, many librarians are asking, what happens when the pandemic funding ends? Now we'll move on to social influences in this pest analysis. In a recent webinar, Growing Digital Equity Through Community Partnerships, librarian and writer Dr. Audrey Barbakoff, formerly of the King County Library System out here in Washington State, makes the distinction between digital equity and digital inclusion. These are definitions provided by the National Digital Inclusion Alliance. Digital equity can be defined as a condition in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. Digital inclusion, on the other hand, refers to the activities necessary to ensure that all individuals and communities, including the most disadvantaged, have access to and use of information and communication technologies. So despite the rise in telehealth in the last 2 years that we've all seen, there's still many communities that have been unable to take advantage of virtual care. A University of Pennsylvania study found that people living in zip codes with a median household income of less than $50,000 were half as likely to have a video visit with a provider of those who lived in zip codes with a median income of over $100,000. For rural residents, where 1 in 5 may be Black, Indigenous, or a person of color, the digital divide may be all too real due to total absence of broadband. And older adults or those with disabilities may be excluded from telehealth visits due to inaccessible technology. We've seen how the lack of broadband access can often amplify other disparities in a community's social determinants of health. How can libraries fill the telehealth gap when many library workers are already feeling stretched to their limits? Some recent articles have focused on library burnout, particularly after 2 years of pandemic. And Dr. Pam de Guzman, who I referenced earlier, interviewed library workers about their attitudes. This was back in 2020, 2021, toward adopting a telehealth program in their libraries. Many questioned how a telehealth program would fall within their mission or worried it would stretch already thin resources. So in their webinars, both Dr. Barbakoff and Dr. de Guzman explain how establishing partnerships with community groups is crucial. Libraries don't have to go it alone. In one of the most notable examples, the Nashville Public Library partnered with Comcast to deliver laptops to seniors directly to their doors. And here for the King County Library System, one of the country's busiest library systems, the library has partnered with the University of Washington Medical Center for its telehealth program, Teleconnect. While this program is still getting off the ground, the librarian's role is mainly to help patrons connect to their appointments, the support for making those appointments or filling out forms, all that is taken care of by the Health Science Center. So like the Pottsboro Library's telehealth program with the University of North Texas Health Science Center, strong community partnerships can make library telehealth possible. And finally, let's look at the last slide for this pest analysis, technological. There are about 19 million Americans who do not have access to fixed broadband at the level the FCC defines as a basic threshold level. Even here where I live in King County, home of Microsoft and Amazon, almost a quarter in the adults in this county have access barriers, maybe slow internet, access that's too expensive, or maybe no devices. And according to Dr. Pamela de Guzman, libraries are ideally positioned to offer telehealth because of what they offer: fixed broadband, computers, technologically savvy staff, and private spaces. So from dedicated telehealth rooms to mobile vans, the last 2 years have seen the emergence of a variety of telehealth programs in many libraries. In New Jersey, you can borrow iPads preloaded for telehealth visits and ready for these visits. In Delaware, a telehealth kiosk manufactured by a company called TalkBox offers private space for a telehealth visit. And for both Hawaii and South Carolina, public libraries offer mobile vans for community telehealth appointments as an alternative location to their libraries. To make these technologies understandable, programs like the Salt Lake City's Library Digital Navigators program have helped bridge the gap across the country. So I'll finish with the pest analysis with a thought. The other day at the health clinic where I work, an older patient approached my desk. She was having trouble sending a message to her doctor, and the app she was using was confusing and hard to see. It turned out she didn't have a working computer at home, and the only way she could connect to her doctor was through her phone. What if she could borrow a laptop through a program like the National County Libraries, and then get help from a library or a digital navigator to assist her with using it? The answer could be as near as her local library. So segueing back into what our group has done, and the group, our telehealth interest group, they will be looking at many of these factors as they design their program. And they'll be looking at the gaps in education for telehealth and how NNLM can fill these gaps. How can library workers and librarians find health resources and evaluate them? And what program capabilities does NNLM already have? In the coming months, the interest group will address these questions, beginning with the design of a telehealth course. As mentioned earlier, some of us will be joining a monthly national discussion with libraries around the country, and this dialogue could offer important insights for the development of future initiatives and best practices. I want to end here with thanking everyone who has helped me over the past 2 months. It's been a great experience. I especially want to thank Katie for her endless support, and Bailey for getting this set up, and for Dr. Perryman as well. I'd be happy to take any questions you might have about my experience or the telehealth presentations that I've provided here. So thanks again.
Awesome. Thank you, Amy, so much for that presentation. And yes, we'd like to open up the floor to any questions. Please feel free to unmute or drop them in the chat, and Amy will be happy to answer them.
Amy, this is Carol. When we began talking about your interest in telehealth, I know that you had reached out to your local public library in Washington. Have you continued that conversation?
I have, with the King County Library.
Yeah.
And I'll actually be talking to Dr. Barbakoff in about 3 weeks. She's actually coming out with a book this fall that talks about community partnerships. So this is an area that I really want to pursue.
Because I'm wondering if you're going to continue working in the area of telehealth, because I think you could very well turn out to be among the leaders in your region, you know, with what you've done.
Well, I certainly would like to be involved in some capacity. So it's definitely an area I'm going to pursue.
Excellent.
Yeah.
Hi, Amy. Thank you. This is great. I guess my follow-up question is, I guess with your working group, will you guys be preparing at all, like a list of these telehealth kind of initiatives across the country? You listed a few, and I just wondered if there was going to be any kind of like white paper or best practice. It'd kind of be interesting to know.
Right. I think that's a really good question. At this stage, with just getting back in the last 2 weeks, reconvening again, the focus will be in the next couple of months and really working on the design of a course, I believe through Moodle. I know George is heading that. And so this will be the first of several courses, I believe. And Katie, correct me if I'm wrong, that will be offered. And there will be other programs in the next couple of years that will be rolled out. The other interesting thing that has happened is, and this is on a national level, Nick Martin, who's with the Delaware Libraries, and he's the one who brought the TalkBox pod into those libraries. It's really interesting. They offer social services and nurses, so it's the whole picture there. But we have been just recently asked to monitor some of the breakout rooms for national meetings with Nick and librarians across the country to talk about telehealth in the upcoming months. And this is a brand new thing. So unfortunately, I'm leaving at the good part. But I think that's the next. As far as a white paper, I think all that is out there in the future. And like you, I'll be staying tuned to see what happens.
Thank you.
think we might have time for one more quick question. I know we're coming up on the half hour, so I don't want to take up anyone else's time. Do we have any other quick questions? Awesome. Well, thank you everyone again so much for coming to this presentation. Thank you, Amy. And I think Bailey has a few closing things for us.
I do. Amy, congratulations. You did it. You made it through the whole semester. I do want to comment to everybody, Amy faced some substantial roadblocks when it came to how our telehealth working group works. NNLM can be a little bit wild sometimes, but Amy held on for the ride and was a consummate professional. So Amy, I think you did exceptional work, and we really appreciate the work that you did with our office. And I think that this presentation today really, encapsulates all the things that you've been working on this semester. So thank you, thank you, thank you. It has been wonderful working with you, of course, and we are also very grateful to Dr. Carol Perryman and Texas Women's University as well. So thank you, Dr. Perryman.
Pleasure. I love the opportunity to get in on almost the start of what I think will become a much larger national initiative and working toward best practice that could not be more meaningful right now.
Well, we think so too. So I'm glad to hear that. So as these activities are coming to a close, we are still excited to continue collaborating with Amy because as Dr. Perryman said, this is, the start of something really big and important in telemedicine. And we do have, lots of folks on this call who have an acute interest in telehealth. So thanks again, Amy. I hope now you're able to take a moment, take a deep breath, and celebrate all of your accomplishments because there are many. Before we depart, I know we're at 9:30. I do just want to share with you a couple of upcoming opportunities that we have for students. At the top here, you see the LAS Fall Development Award. We offer that every year to attend MLA chapter meetings. That will be coming out a little earlier this year than usual. It will be coming out in July, and it is intended for grad students. So if you know a great grad student who would love to attend their MLA chapter within Region 3, their MLA chapter meeting, and give a presentation, this is a great opportunity. And then also next academic year, we'll be opening up 2 more internships, and I will be excited to share more details with you about that as they become available. So with that, I just appreciate all of y'all being here both this week and last week for our intern presentations. And Amy, I wish you were in person so you could hear the applause that you deserve. We are just so grateful to have had you, and we're grateful for all of our interns. So with that, thank you everyone for coming today, and have a wonderful weekend.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.